Assalamualaikum. I am your host Faisal and you are watching Foresight. Viewers, monkeypox or Mpox virus, which was first discovered in humans in 1970 in what is now the Democratic Republic of Congo. Since then, there have been 27,000 cases and more than 1,000 deaths, mainly among children. Since the current outbreak began in January 2023, this year alone, the disease killed at least 548 people so far in this African country. Mpox is an infectious disease caused by a virus transmitted to humans by infected animals, but can also be passed on from human to human through close physical contacts. WHO declared it a public health emergency of international concern. Such an emergency has only been declared 7 times previously since 2009. So far, disease outbreak is reported from 13 countries in Africa and 2 out of African continent, Sweden and Pakistan. We try to explore the virus transmission, symptoms, fatality rate, the role of border detection services and the importance of vaccination. We will also examine Pakistan's preparedness, disease surveillance and response mechanism, as well as the availability of vaccines and the treatment options. To discuss this very important topic related to Pakistan, we have in our studios Dr. Naima Javed. She is the faculty of College of Physicians and Surgeons and also the consultant. Most welcome to you, ma'am. Thank you very much for your presence. And online joining us, Dr. Shafiq Rehman. He is the scientific officer at NIH. Most welcome to you, Dr. Sahab. Thank you very much. My first question to you, Dr. Sahab, that after the astonishing rise in Mpox cases in Democratic Republic of Congo, its spillover in the neighboring countries and now globally, it rose alarm across the world. Sweden and Pakistan also witnessed these cases, while WHO called it a public health emergency of international concern. How do you see it?
Thank you very much for inviting me on this program. Yes, WHO declared public health emergency of international concern on 14 August. The good thing for Pakistan, as well as in terms of preparedness and response, is that as we detected upsurge in the Democratic Republic of Congo, which is being since September 2023. So we issued an alert to the border health services authorities to be vigilant and enhance screening at all point of entries. So as the WHO has declared it as PHEIC, Public Health Emergency of International Concern, as we already know that it is previously being declared as PHEIC in July 2022. Since then, Pakistan, under the leadership of Ministry of National Health Services Regulation Coordination, is looking after the situation globally as well as at national level. So, good thing for Pakistan is that though we have detected the first case since the PHEIC is being declared, that is the clade 2B. As we all know, is that there are 2 strains, or we can say clades of Mpox. So the good thing for Pakistan is that all the cases.
You are referring to that clade, basically clade 1B is supposed to be the more deadlier than the clade 2B. Yes. So how do you see that this virus particularly, and what mostly it called that the zoonotic diseases are extremely deadly, spread fast, they transform quickly into different atmosphere and environment, as this is the second successive public health emergency of international concern declared on Mpox particularly. Just in May 2022, Mpox infection surged worldwide and WHO declared it a lethal one. So how do you see right now what is right now happening, and the 2 cases which came in Pakistan, do you think that they are related to clade 1B?
No, as we have presented at the National Command and Operations Center Forum, that the recent the case which was positive from Khyber Pakhtunkhwa, it belonged to the strain clade 2B. It is good thing for Pakistan that though we received a positive case, but it is clade 2B, and we all know that clade 2 is least severe in its disease illness as well as its case fatality rate. So yes, the bad news is that the Sweden, it was the first time that the country outside Africa reported the first case of clade 1B from Sweden. So yes, although the disease is not as contagious if it is clade 1 or clade 2, and as well as there is no such case fatality rate of this Mpox. It mainly affects the high risk groups, mostly the people who are with existing comorbidities encounter and develop severe illness related to Mpox. So, in Pakistan, all the cases before its declaration to PHEIC, and after that, all cases are from clade 2B, and most of them, almost the cases have recovered, and one case which was recently detected is also with the mild symptoms and is being isolated and is being observed by the provincial health authorities.
Your point well taken. Your point well taken. It is heartening to know that at least clade 1B is not there. Dr. Sahib, Mpox is closely associated with smallpox or the variola virus, belongs to the Poxviridae family. It enters through the skin and airways. What type of symptoms appear in a Mpox infected patient, and how many days after the infection, what the patient and his or her family has to do in that particular case? What if no symptoms appear? Because in certain cases, medical examination suggests that there was no particular symptoms in that case. So, whether it is treatable or not?
In this case, you must know that the symptoms vary from individual to individual. The disease has the normal incubation period from 5 days to 21 days. Okay. That is very important and very particular for this disease. Okay? Because in this era or in this period of 5 to 21 days, the virus replicate in your body. And after that, the typical presentation within 1 to 5 days is with the high grade fever. It's more than 38.5 degrees centigrade. So, after fever, it has body aches, body pain with the rashes. Okay? The major particular rash appears specifically on your soles, on your palmar side, on your face, on your perineal and genitalia areas. So, any healthcare and later on your trunk and body. So, that is very confusing for some of the consultants, for some of the healthcare providers, and it should be highlighted that it do resemble with the normal chicken pox some ways. But as a doctor, to whoever the patient comes and they examine the patient, the chicken pox usually appear on your trunk and body first, and later on they appear on your rest of the parts of the body. But this virus is associated with your palm, sole, genital areas, and you feel some swelling on your neck areas, which are painful swellings. In our medical language, we called it lymph node enlargement, and in your genital area. So, the people should know this difference from chicken pox too.
And sometimes there are pus-filled lesions as well?
Yes. Now, come to the rash. There are different types of the rash, 5 stages of the rash which appear. Patient can present you at the redness stage. Then the second stage is there are raised lesion. Then on those raised lesion, they become filled with the water, fluid, and then they become infected. Then they become the scabs. Okay? So, the patient is infected during this whole period. So, until the scabs fell off, and the new skin is formed, the patient should be isolated from rest of the persons to be exposed, because even those healed scabs and everything contain the highest amount of virus as well.
Your point well taken, ma'am. Dr. Naima, WHO insisted that the Mpox transmission could be stopped with a concerted efforts and recommended 2 vaccines for immunization. Now, what are the efforts required to stop transmission in Pakistan? Number one, what infection control measures required? What are the vaccines available, and whether those available vaccines are there in Pakistan, their stocks are well managed, because ultimately we have seen in COVID that there was a global emergency for the vaccine. So how do you see that?
You are 100% right that it's a public health emergency which WHO declared on 14th of August 2024. And the major thing in this case is that prevention, because it's not an indigenous disease. Luckily, it's not present in our country right now.
Definitely.
But it's across the border disease. So, the major thing I think which particularly should be assured that all the travelers who are traveling, their history, their epidemiology is very important, from which countries they are traveling to our country. So, if they have, they should at the airport we should manage these things in terms of your travel history, the contact with any of the, and if they are traveling from high epidemiological areas, then those data should be recorded, and those patients, since it has an incubation period which I have already mentioned of 5 to 21 days. So, they if they are coming from the high epidemiological areas, they can be observed for the symptoms like fever, even the family persons, even the person himself, they can experience all these things like fever, rash or anything, they can be monitored at home. Then all those particular measures which are generally important for the infectious control, like wear your mask, wash your hands, God forbid if you get any of the fever or any of the thing while you have traveled from the high area, do report to your local infectious disease control program who are doing the surveillance, like to your local district. I think they have developed some of the things.
Definitely, definitely. So, the question arises here is that how much we are prepared for this particular virus. What about the disease surveillance? As you have rightly mentioned that we have strict border controls, the entry points particularly. Then screening, implementation of those protocols, response, quarantine facilities or isolation wards, equitable access to the diagnostics, vaccine supplies for clinical care, and maintaining the cold and supply chain mechanisms and other tools. How much we are prepared on that?
For general public, they should, because this is the take home message for the general public is that yes, you asked me in previous question that doctor, what is the difference from the COVID and this disease?
Definitely, definitely.
That was a new outbreak for whole of the society, and it was just a new thing for even Pakistan and for rest of the world, and even WHO, because no previous vaccination and no workup was done for that disease. The best thing about this is that the smallpox vaccine, which though it is eradicated in the globally in 1973, but still that vaccine is there in the community, in the market, it's available, and WHO can provide that vaccine to those who are at the high risk, the healthcare worker and all those. The vaccine is available, though it's not available right now in the Pakistan, but since WHO has it, so when they have declared it as a global emergency, they are managing this thing to those who are at the high risk of getting this disease. In terms of the preparation of in terms of prevention of the disease, prevention is always with the vaccine. Then once the disease is diagnosed, then the prevention is that you have to avoid the contact, because the major spread of the disease is through contact from person to person. Though with the direct lesions which are present on your body, though there are some cases and some data says that it do spread from the from your droplet infections as well, but that need to stay for 5 to 6 hours in a closed room, by which you get the virus load and then droplets. So, the best thing is wash your hand, wear gloves, use the mask, change your clothes when you are exposed to the condition, and do report at your local health care facility that you are exposed to this disease.
So how a patient or a person who is infected with Mpox could be detected and the virus could be detected with the normal PCR test, that polymerase chain reaction test is okay? We can test through that, or we need a detailed examination for that?
You know, as far as the patient is concerned, we definitely need to have the detailed examination of the patient in terms of seeing his lesions.
Okay.
Then we take the fluid from those lesions by a scraping test, and there are specialized kits available at National Institutes of Health. It's available in the Chakshazad.
Obviously.
They have the special virus transport media by which we take 4 samples from different lesions which are present on your body. So they can be present on your visible part of the body, they can be present in your mouth, they can be present in your genital areas, so that all the areas should be examined properly. And if the lesions are present, we have the kit available at National Institute of Health, and we can test it properly.
Your point well taken. Dr. Shafiq Rehman sahab, like Pakistan received the first case of Mpox from the Gulf country. We have a lot of direct influx from the Gulf region. The African continent have recently given visa-free entry to at least 126 countries as well. In such a scenario, international travel must be well monitored. Best surveillance, required detection and vigilant screening at all entry points, especially the airports, the land borders, the harbors. That is necessary to stop the spread of this disease. So how do you see particularly?
Thank you very much. Yes, unfortunately, almost all the cases we receive from the Gulf countries. So, in order to detect earlier at point of entries, NCOC has taken an initiative and disseminated letters to border health services authorities which are related to this special task. So they have now designated their quarantine centers. They have enhanced their surveillance. Throughout all the passengers, whether they are coming through international airline, they are through the land crossing, are being screened, and all the data is being shared with NIH, as well as the personal protective equipments are being provided, as well as the IEC material, information, education and communication material is being provided and is displayed on the each of the international airport for the community awareness. As far as the surveillance is concerned, so we are through provincial disease surveillance and response units, we have notified them to designate the focal person, provincial focal person, as well as the hospitals, designate hospitals, in order that whenever the patient is suspected, then he or she can be referred to that hospital. Also, quarantine facilities, isolation facilities are being designated by each of the province and region. Also, in order to, you can say, enhance the surveillance, all the provincial partners as well as the departments are continuously in coordination with NCOC.
So, Dr. Shafiq, when we are talking about the beside human screening and the quarantine of the suspected cases, what about the animals and bird species imported from different countries, even from African continent, or passengers carrying their pets during international travel? And small mammals like squirrels, monkeys and rodents are highly susceptible regarding this Mpox disease. So how do you see particularly whether the screening is there at the airports and other entry points to check the pets and animals also not to spread this disease in the country?
You know, in case of animals or humans, the surveillance system we can establish at airport is the syndromic surveillance. Whenever there is any suspect, the border health services authorities do detect and triage that case. that particular person. In case of animals, yes, border health services are in coordination with provincial livestock departments, because this is the mandate of the provincial livestock department to identify or detect such suspicious animals with carrying probable pathogens. So the system is in place, and we are in coordination with livestock as well as the border health services for strengthening our response and surveillance.
Well described, Dr. Shafiq. Dr. Naima, do you not think that, like other viruses, Mpox would also affect SWARE to some individuals, like children, the pregnant women, or the persons with weak immune system due to their other health conditions like heart disease, diabetic, blood pressure, asthma, epilepsy, or any other? So do you think that they could be more affected if unfortunately infected because of this Mpox?
All of these which you have mentioned, whoever have the previous risk factor, with definitely the age bracket of young to the elderly, without even having any of the diseases, and the pregnant woman. These are the three major things which are present even without diseases. So the age brackets and the pregnant ladies, yes, they are definitely at a very high risk of getting all these viral infections. So when you start the surveillance, then definitely you have to have a major concern and major protocol to prevent all these age brackets.
Definitely, you are absolutely right. So what could be the urgent measures to spread the word regarding specific guidelines or protocols in place for health workers like you yourself, doctor, paramedics, the lab and OT technicians, the ambulance drivers, the helpers, assistants, the sanitary workers who are working at the different clinics or hospitals, regarding handling of the suspected Mpox cases, their clothings, bed sheets, or all others, because they are the one who are the first responders and might be more vulnerable to be infected.
As a healthcare professional, yes, we are more susceptible to collect all these diseases. So the primary care is the prevention. Okay, so in order to prevent the diseases, yes, in order to hold these things, to handle these things, the surgical gloves, which are the disposable, or the surgical gloves, the face masks, then your PPE, which usually the kits are available. So that is personal protection, your kits which are available. So yes, you should use these things so that this disease has a highest spread from direct contact. So when we contact with the patient, so we can be the source of the spread as well. So as a healthcare professional, we should do these measures for ourselves as well, and for protection to the community and the society as well.
Well said, Doctor. Well said. Dr. Shafiq, it's only one clade or type, or there are multiple outbreaks of the different clades or types in the different countries with different modes of transmission, different level of risk, and might be having slightly different ways of treating it, and needs to have the different types of vaccines. Is it a correct translation of that? Because most of the health practitioners across the world and even scientists are debating right now that Mpox virus could be changed into a lethal variant when it enters into the different atmosphere or the different environment.
As of the Center for Disease Control's US guidelines, the Mpox virus, yes, it's true that it continuously changes its genomic sequence, but almost 99% its mutation are non-specific. Okay, so currently it would be inappropriate to say that it is mutating in a lethal strain. As of the literature review, as of the CDC and WHO recommendations, I don't think so that it is going to be more lethal. Yes, although there is as we have already reviewed the data that the clade 1A and clade 1B, yes, they have somewhat severity as compared to the clade 2. So almost the treatment as well as the vaccination are not as much different in both of these clades.
So when we are talking about Dr. Shafiq, after COVID-19, WHO had on August 7th, 2024, initiated the process of emergency use authorization. It is related to the vaccine, you know, particularly, which is developed to expedite the availability of the unlicensed but safe, effective, assured quality and suitable vaccine for targeted population. But do you think that it will cater the needs, particularly when it comes to the global transmission?
WHO, yes, agreed that WHO has requested other international agencies to work on the vaccines for Mpox, but it will again will focus on high risk groups. If we talk about those communities where this disease is more prevalent, as well as the responders, or the certain communities with existing comorbidities are immunocompromised, yet then we can consider it to utilize or provide vaccination to those communities. Otherwise, as far as our situation of our country, there is the good thing is that we do not have any indigenous case. So it will be very earlier to decide that we need vaccination at country level or not.
Your point well taken, Dr. Sahib. Dr. Sahib, when we are talking about the vaccine, the proper vaccine for Mpox, whether we have any plan to start any sort of a potential vaccination campaign or at the national level, or secure a portion of vaccine for our population from the international community, especially if new variant is confirmed, and also compel international community to give adequate vaccine provision for the developing countries like Pakistan, because early intervention, the transparency and international cooperation is actually the key to success in such outbreaks.
You know, as Dr. Shafiq has already mentioned that luckily it's not an indigenous disease of our country.
Definitely.
So yes, vaccine will definitely have an effect on prevention, and we should not keep our eyes closed, and we should work on these guidelines and these lines that yes, vaccine should be available. But we really have to see economically that, as well as that who are the suitable candidates for those vaccines as well.
Definitely.
Provided the healthcare workers, the close contact with the animals and the other workers, in Pakistan it's not a endemic disease of the Pakistan, so we can definitely think on these guidelines.
So, Dr. Naima, as a doctor, what you suggest that what the people of Pakistan has to do, like hygiene, you have to wash hands, you have to have some sort of cleanliness, you have clean clothes, you have to avoid those type of travels which are going to be very interactive with the animals particularly, or to have some sort of a precautionary measures. What you suggest actually for the people of Pakistan?
You know, as far as the normal hygiene is concerned, irrespective of the viral disease or any other things, we should take care of our normal hygiene of washing our hands, particularly when using your phones, using your because the phone is the major medium of carrying from one place to another place. So
that must be disinfected.
Yes, that must be disinfected. Then our hands should be clean.
Sanitizer should be used.
Definitely sanitizers should be used. Then the face masks should be used. The clothing should be washed. And God forbid if you have any of the patient whom you come across and whom you are known as a healthcare worker, so you should take the particular measures about quarantine yourself as well, so that in those particular periods of initially 2 to 3 weeks, especially 3 weeks, until you don't get the symptom, luckily, then yes, you should take care on these things as well.
Well described. Dr. Shafiq, one last word, that most of the times we have seen that if anyone of your relative who is working there in Gulf countries or in Africa or in Europe or somewhere else, and when he comes to Pakistan, come home, so most of the family members go there and to receive him or her. So do you think that we should have to adopt some sort of a care at the highest level and maintain that hygiene, that no need of going lots of people to the airports or to the land border terminals to receive your guests and all that? So those precautionary measures must have to be there, so that the government work must have to be a bit easy to handle and to target and to detect such type of viruses.
As I have earlier mentioned, that the syndromic surveillance at the all international airlines and all other point of entry has been established. So also NIH, being the focal point for international health regulation, is also in contact with those Gulf countries to notify them, and also to share information related to all those deportees and all those passengers coming from those endemic countries for Mpox, as well as from Gulf countries, priorly before their travel or before their arrival to the Pakistan or at any international airport. We are in contact with through IHR. Also, we have to respond smartly. We do not need to panic the community. So the first thing for us is to enhance surveillance at all point of entries, and if there is any suspected, there is a mechanism that the person is being triaged before his or her meeting with the relatives. So he or she is being screened if suspected, and he or she is being triaged and referred to the designated hospital nearby. And so in order to limit the transmission or contact with the other persons.
Definitely, your point well taken, Dr. Shafiq. Thank you very much for your time and online. Thank you very much for your candid views as well. Dr. Naima, thank you very much for your presence in the studios. So nice of you.
Thank you so much for inviting me on such an informative program, so that we can help the community.
Viewers, as you have just listened to our panelists, and it is fortunate that Mpox disease have no local transmission, fortunately. We have only one patient so far who was there in Khyber Pakhtunkhwa and well quarantined. So it is needed that the health services, which are very vigilant right now, the border health services also be very vigilant, because the Prime Minister Shehbaz Sharif, he categorically stated that this disease must have to be stopped entering into the country, and he strictly ordered not to let any suspect Mpox case go unchecked. So now, as Dr. Shafiq has described, that all the airports, all the entry points, particularly the land border terminals, including the harbors, all of them are in strict vigilance, and the surveillance is there. The screening mechanism is already set up over there. The Mpox is surging across the world. Unfortunately, lots of deaths there in Democratic Republic of Congo and the rest of the African countries, entered into the Europe and Sweden particularly. Pakistan is also has one of the case, at least that is again fortunate that is the clade 2, but we are hopeful that the particular patient is going to be normal soon and he will recover. But this clade 2 is not much harmful as compared to the clade 1 or 1b. But as the virus is surging in different parts of the world, particularly in Middle East, where the millions of Pakistanis are living and working there, so we have to be more vigilant, especially when we are talking about the surveillance and the border health services and the screening mechanisms. Those must be intact. National Command and Operations Center, that is coordinating well, and they have issued one advisory earlier. Our health system overall across the country is very vigilant on that aspect as well. Like COVID-19 pandemic, we have to have better coordination among the federal and the provincial governments, which is now in process. As our doctors have already said, that the elderly people, the children and the pregnant women, they are the most vulnerable. So by adopting the normal hygiene, washing hands, using sanitizers, and have little contact with those who are infected with the Mpox, everyone can save lives of their own and the lives of others. We have to save lives across the country. We have to stop this, the prevalence of this disease, and so that we emerge strong. So this is today's Foresight. It's time to sign off.